I'm a drummer as well.
Oh, I didn't know that.
Layers, Sue, layers. Like the onion.
We are live.
Okay, thank you. So we are live. We are now, it is 11:21. We are now in open session, and I declare we discussed only the items that were listed on the closed meeting agenda. And I will ask our vice chair to confirm that. Alan?
That's correct.
Thank you. Next item on the agenda is item 7, correspondence and news releases. And we'll start with correspondence. Drew?
Thank you, Madam Chair. I'm going to be taking care of this item. Drew is off today.
Thank you, Dr. Era.
So there are 3 items on correspondence. The first one is from the mayor of the city of Hamilton, describing the importance, re-emphasizing the importance of the connection between municipality and public health for the effectiveness of public health services. And he referenced the outbreak or the pandemic as an example of reinforcing this position. The second item on the correspondence is from the Board of Health of HKPRD Health Unit, and they thank the government, the provincial government, for the 2020 100% mitigation funding. That's same funding that was reduced for public health in 2019 proposal. It was reversed for this year and for 2022. And the Health Unit Board is asking the government to consider increasing public health funding, especially for the recovery that's going to come after the pandemic, and for the fact that COVID is going to be endemic, is going to be with us for a period of time, and to cover the increase in wage benefit and operation costs due to inflation. Those have not been factored in public health budgets. And this item, the recommendation is to endorse. It has a different aspect to it. From the previous communications and correspondence that we've sent and endorsed. Ministry, the third item is from the Ministry of Children, Community and Social Services, approving the funding plan for the 21-22 for the Health Unit. And the correspondence recognizes the Health Unit, our Health Unit, for the leadership in providing services during the pandemic, and specifically recognizes the innovation and different approaches, whether it's the virtual services to communities, loan phones or tablets to facilitate access, and other solutions that our team has come up with to ensure the services to the most disadvantaged continue during the pandemic. And this is the recommendation is to receive this item.
Okay, and news releases, and then we'll do the motions.
Certainly, news releases, we have a list of them as the usual during the pandemic. And the most pronounced of them is the 3rd dose vaccine for immunocompromised patients, the vaccine passports, the recommendation for workplace vaccine policies, and unfortunately for one opiate overdose alert, where there are 4 suspect fentanyl doses on over 1 weekend. Nevertheless, all the media releases serve the purpose of sharing information with the public that they can act immediately or with the best information at hand.
Okay, thank you. So we do have a recommendation to endorse 7.1.2, requesting ongoing provincial government financial support for local public health. Any discussion or mover and seconder to endorse? Mitch to move and Brian Millen to second. All in favor of that endorsement? That is carried. So then we also need a motion to approve the correspondence, the remaining correspondence and news releases as presented. I need a mover and seconder. Selwyn and Helen Claire, all in favor? That is carried. Thank you. Item 8 is the Medical Officer of Health update. Dr. Era.
Thank you, Madam Chair. I'm going to share my screen for a presentation that I will start, then Dr. Zaid will complete.
Okay, excuse me 1 second. Nick, I noticed your hand was up. Was there something regarding the news releases or correspondence?
I just wanted to raise a point here, being as out on the media. I think that I know that it is not a reflection of the Grey Bruce Health Unit. However, I think that we need to reach out to the communities, the local Indigenous communities, letting them know about the expired vaccines that were given, being that it is in the media, and let the rest of the Grey Bruce area know that this is not a reflection of the health unit, or that it was a misstep created by somebody else, taken by somebody else, and not Dr. Era and his team.
Okay, thanks, Nick. Dr. Era, did you want to comment?
Thank you. I can definitely comment here. I was going to include it in my update as MOH, but it can definitely fit under communication. So there was an unfortunate situation where expired vaccines were given to individuals, number of individuals from the Saugeen First Nations. The Indigenous Service Canada, our federal partner, issued a statement September 23rd, and they took ownership of the administration of that expired vaccine. And we have been working with the Community Health Center and with the federal partner to ensure remedy is in place for these individuals. The only harm is the fact that the protection from the second dose of vaccine will not be there until we provide it again. And there are steps being undertaken as we speak to ensure the protection is provided as soon as possible to these individuals. In communication with the Saugeen First Nations, as we all know, they have the authority and the jurisdiction over the issue. So the health unit cannot issue a release or a media release to speak on behalf of the community without direction from the council and the chief. However, we've been supporting in the background with different methods of communication or with the communication process, and we stand by for support in any way we can.
Thank you. Any comments or questions? Okay, Dr. Era, please continue with your update.
Thank you. Just sharing my screen. There should be an Excel sheet there.
There is.
So, Madam Chair, Board, there has been work on recovery from the pandemic, or planning for the recovery and proceeding with different aspects of it. But at the same time, to maintain level of response, since the Delta variant has changed the equation and the recovery might be interfered with by a fourth wave. So in general, sorry, I'm trying to get the screen to be at a level where you can see. This should be better. It's just manipulating through Zoom is not as easy. So the organizational chart, so for recovery, the Board of Health and the Board of Health is the head of the organization, the Medical Officer of Health Office, myself and Dr. Zaid leading this. We have two parts of the organization, the corporate, which would include Director of Human Resources. The recruitment for the director has been completed nicely. They will be joining us within days. And the operational part on the left, we have two directors of operations. And we have looked at a model of matrix organization, and Dr. Zaid will provide more details on the matrix. And the matrix organization will include the functions of these functions over here. where I'm pointing. It's the foundation standards and how they would interact with the programs in the operations. There are different models to use it. The matrix organization is a very effective way to do it. Nevertheless, it requires way more communication and specialization, and to open doors for development of staff in certain specialties in public health. And we are looking at utilizing this structure. And I'll go a bit in more details before going to the second part, which is the response to the emergency. Sorry, with the Zoom, it's really difficult to manipulate two softwares together. So the corporate on the right, the operations on the left, and the operations is two big columns with the foundation standards under them. And if I go to the other slide here, these are the two operations led by the two directors. And you look at the programs, whether it is chronic disease, injury prevention, oral health, under one manager, vaccine preventable disease, and that's the vaccines in the schools, vaccines in the community, not related to COVID, school health, healthy baby, healthy children, harm reduction, environmental health, tobacco enforcement, and infectious disease. Those will be contrasted with the foundation standards in a matrix format to ensure each one of these programs, whenever they're operating on any task or a project, short-term or long-term, there is a lens that includes equity that you can see on the far right in the, I think it's a pinkish color, equity, effective public health practice, population health assessment, IPAC, infection protection and control, prevention and control, emergency management, and communication. So I will leave these details for Dr. Zaid. And my last point here is the org chart, the way it works. This is what we do services with. We have on the very right, the ECG structure, which is very similar to IMS. The two systems talk to each other. IMS, the newer system, ECG is the old one. When we started the emergency response in 2020, we used the IMS. However, IMS is very taxing and it's very fast paced. And ECG for management of a fourth wave, when there are structures in place and people know the response, whether it's in the school, whether it's in the community, in long-term care, or in communication related to all these aspects. So we will have a hybrid situation where we're to have a response through the ECG in the green and providing all the services that we provide and ramping them up through the organization structure, also called COOP, Continuity of Operation Plan. I'll stop sharing there and turn it to Dr. Zayed to provide to the board more details on the matrix and our vision for it.
Thank you, Dr. Ara. I'm just going to give a brief presentation. As we mentioned, as Dr. Ara mentioned before, that the foundational standard work took hand in hand or align with horizontally with the operations of programs. So I'm going to just give a highlight on how this matrix is working. Outline of the presentation. Can you put the okay, next slide, please. So the main outline of the presentation is what is a matrix management, because when we talk about the word matrix, it might be interpreted differently with different context. How it is developed, why we need it, and some guiding principle, and creating opportunities and looking ahead. So the matrix management is an organizational structure in which some individual report to more than one manager. So this is a dual reporting, a functional manager, which is the usual hierarchy, and as well as a project manager, as they work on different projects within the organization. So it is a dual reporting relation as opposed to the traditional management reporting structure. In its simplest form, it is known as cross-functional work team, which brings together individuals who report to different functions or part of the organization. Next. So under the matrix structure, employees are directed to where they are mostly adding the most value for both the short term and the long term. It's a culture change that needs to be planned and managed over time. So with that, we can have more, like using more talent and skills and highlight the development needs, define roles in terms of output, not input. So it's really goal-oriented and align system to support the new structure, invest in training and coaching because it really gives opportunity to people to show their skills and communicate. Like it requires really over communication to those affected and monitoring progress and making necessary adjustments. So it's a kind of continuous evaluation. So why we do that? It's again, as I mentioned, it's goal focused to improve the organization's ability to accomplish high impact goals, especially that we are moving to recovery and we have been almost 2 years lagging behind in some like community or population health services. Its speed reduces the amount of time to accomplish cross-functional objective, ability to handle complexity, the complex issues that we have, like the wicked health problems, the wicked public health problem with socially complex aspects, capacity utilization and subject content expert building, greater professional development and opportunities, higher and better use of staff time and talent, team building opportunities, set priorities in an explicit way. So as we see here, this is the usual, the traditional organizational chart with like vertical hierarchy, while when you use the matrix, we can have the functional manager as the usual hierarchy, and in the same time, there is a project manager managing staff across the organization or across the program, with every staff has certain next slide, please. Yeah, so with every, we see here the matrix structure with a project manager managing staff horizontally across the organization from different programs. There is this dual reporting for functional manager and project manager, but in the end, it will really build skills and make work more comprehensive. Next slide. So again, finally, there is this difference between a functional manager and a project manager. So this is some sort of, as we are going through this change, it has to be really clear to the staff and the organization what is to be. So for the project manager, which is the matrix business manager, the main question is what is to be done, when the task will be done, why the task will be done, how much money is available for the task, how well has the total project been done. So it's a time-bound project. While in the functional manager, how will the task be done, where will be the task done, who will do the task, how well has the functional input been integrated into the project. And so the project manager and functional manager talk to each other for a high impact public health complex issues. Next. And when we talk about these health issues and the matrix model, it's also worth talking about how public health impact is having the more investment. As we can see, the down arrow showing the increasing population impact, while the up arrow showing the arrow going up showing individual effort needed. So it is important to say where our work is mainly population based and with the highest impact on the population more than the individuals. So if we work at the base of the pyramid, so investing in socioeconomic factors, which is the social determinants of health, has the highest impact on population. And if we go and then changing the context or changing behavior and the individual's default decision to healthy behavior, long-lasting protective intervention, clinical intervention, and finally, the apex of the pyramid is the counseling and education. So we can see the difference between a public health work at a population level and individual level. And in some complex issue with these 5-tiered pyramids, we have to work, or the intervention can be actually on the 5 levels. So this is how we really make an impact, and we know whether this impact is individual or population based. Next slide. And again, who is working with the program, there is this working on the matrix. A foundational standard is working on the left side, which is a distal factor related to social determinants of health, while other, like we can have the health promotion, chronic disease, injuries, would work on the risk factors. And with that, we can really liaise together the work in a matrix structure to achieve the health outcomes that we want. Again, this is really a culture change or some change in how we think or make the work. So we have to have also a realistic expectation. So guiding the principle here is mainly the balance between responsibility and accountability. By spending enough time clarifying what individual roles of teams can contribute. Business project must be well delineated, so it will be like what kind of project or issues that require this matrix in a business model, a clear understanding of organization's objective, the right system, procedure, and resources in place, balanced utilization of capacity or human resources, clear understanding of the existing procedures and how the matrix role should be shaped to match the capabilities of the people in them, in mechanism in place to help individual teams and decision makers to cope with the transition, inevitable confusion and disruption. So we really have to plan that in a very well manner with a lot of coaching and education and communication. What to consider for the change, the overall strategy, the needs, the current structure, the organization, what other organizations are doing, our stakeholder in the community, the talents that is available, what area in the organization that will benefit most of the matrix. And what to think before we act, that the change is a major upheaval. Change is a culture change that will need to be planned and managed over time. Not everyone will be comfortable with it. Consider persons who have personal investment in the role and status in hierarchy. So we need really to consider these factors. Matrices are dynamic, creating ongoing challenges and requiring ongoing decision-making. Assessing talents can better identify those who are likely to be successful in their roles. Force field analysis to allow the appropriate pace for the initiative. There are many opportunities. I'm just going through that quickly for health equity. These are the main opportunities that we have that can be for a matrix structure, especially with the health equity lens. And there is also opportunities in population health goals for healthy infant children, healthy youth, and healthy communities. And looking ahead will be that we are working to develop the matrix management from silo to system, using population health data to define health goals, priorities, and reduce inequities across groups, and implementing intervention that reach the whole population with a focus on social determinants of health and relationships with non-health sector partners. That's the end of my presentation. Thank you.
Thank you, Dr. Zayed. I want to ask, when do you plan to start this? I'm sure it's 2022.
We are starting it now, actually, with certain priorities. So we started needs assessment with this team of foundational standard. They are starting to talk to the programs with the needs assessment of the programs. In addition to that, the program itself started to do SWOT analysis. We gather this together and we will have the project that require matrix structure and based on the prioritization of the health issues.
Good. So a gradual launch. Questions, comments from the board? Okay. Chris?
So what steps will you and Dr. Ara take to make sure that obviously some of the employees might have some anxiety about these changes, as you mentioned in your presentation, and what steps will be taken to manage those anxieties to make sure that our employees do buy into this new organizational structure?
I can take a first step at this question. Organizational change and management change is a well-known subject in management, and our staff have gone through many changes, and the same process is usually utilized. We communicate early on, and we started communication about this in April and May about recovery. We collected input from the managers, and we encourage them to look at their programs and the way they function and the skills of the staff, and to recommend what portfolio they wish to utilize to better their career, and to have a list of these preferences. Then we bring back this information, and it is collected through different channels, whether it's a survey from the support team that Dr. Zaid leads, or through the one-on-one between the directors and the managers. We looked at the portfolios at senior management and we aligned them. And we took this information back to the managers to see the buy-in and to see how that's going to fit. Obviously, it's not going to be perfect for everybody, but it will align to the best of our ability with the skills and with the need of the organization and the community. The staff will have always been communicated with about these stages and these steps. And this organizational chart was shared with the managers and the staff. And we talked about it in at least 2 all-staff meetings as we progress in the process. And again, we have a group of staff, or our staff are healthcare professionals or other professionals, if not healthcare, and they're quite accustomed to the process of management change and improvement in the organization.
Thank you, Dr. Ara. Any other comments or questions? Helen Claire?
Yes, thank you. Through you, Madam Chair. I'm really pretty excited about what we've just been shown. We have a high-functioning team, and they've had to be agile in an incredible way for the last 2 years. I think it's a perfect time to attempt a positive change such as this. Specifically, I think moving to a focus on goals, moving more so to a focus on goals, is going to help the morale of everybody, because it's so much easier to have results, to see results, to track results. Again, in comparison to what we have, all of us, and what they in particular have had to go through over the last 2 years, where the goalposts keep changing. Flatten the curve. Now let's do this. Now let's roll out the vaccines, and so on and so forth. So I'm pretty excited to see how this works. Thank you, Madam Chair.
Thank you. Anything further?
Madam Chair, if I may add, I really appreciate what Helen Claire mentioned, and I am excited about the opportunity of building the matrix, and if we are successful, and I see, reasons why this might be delayed or not completely in effect because of the pandemic and because of the changes in the system itself. Nevertheless, I'm very excited that when we are able to function through this matrix, we can tackle complex problems. You look at the opioid crisis that our communities in Ontario and the country have been tackling. It's not a problem that can be fixed by one program or by whether it's health promotion or health protection or communication. It is the combination of all the tools that we have to allow us to tackle such problem. Dr. Zaid calls them the wicked problems in public health. They require that level of sophistication and response.
Very good. Dr. Zayed?
Yeah, through you, Madam Chair. I just want to comment also that the staff are really well engaged. They are really high-skilled staff and very motivated and talented. So it is a great opportunity to show their talents. The other thing that some of the priorities that we are taking now in consideration, as Dr. Era mentioned, is the opioid emergency or problematic substance use emergencies. The other thing is high priority populations. And the third one actually is the work environment wellness. So this is something that we will really consider it of some of the high priority health issues that we will consider matrix work structure with it, but I'm waiting for the feedback from the staff as well.
Good. And we look forward to updates. Okay, Dr. Era, continue on with your update.
Madam Chair, two quick items. The public health modernization is a standing item. There has not been formal movement on this item from the ministry. Nevertheless, the Chief Medical Officer of Health Office had certain change that can align with this item, where 5 associates of the Chief Medical Officer of Health were appointed, and their service areas are very consistent with the Ontario health regions. So nothing specific there. It's a move that can increase communication, but at the same time, it could be a step in that modernization or planned modernization. And I will keep the board updated if there is anything formal or if things aligned towards that.
Okay. The opioid situation in Grey Bruce.
One item, we continue to see the same levels we've seen in 2021. And one item of interest is working with the county and different County of Grey and different partners to have an initiative of mobile unit van that can provide services related to the opiate situation in Grey and Bruce. And obviously it will be a type of pilot, and if there is success that we expect there will be, there can be scaling up of this initiative and utilizing it in wider space in Grey Bruce.
Thank you. Any questions or comments for Dr. Era? All right, so I need a mover and seconder to receive the Medical Officer of Health update. Brian O'Leary and Mitch, all in favor? That is carried, thank you. Item 9 is corporate services, and we have the financial report for July of this year. Drew, or sorry, not Drew, I really want Drew to be here. Matt.
Thank you, Madam Chair. Very quickly, most of the numbers I think are fairly explanatory. However, there is a reporting update. I just want to reiterate the previously communicated item where we did receive half the year's additional financing or additional costs that we're incurring to respond to the COVID-19 response. And in this Q2 report that we've just submitted, we had the additional ability to ask for further funds, which we have done. And that was predicated on both how have we done so far year to date and what is the forecasted amount from July 1st to the end of December. So I think we hold ourselves within good standing. It is within the original budgeted amount presented to the board. And we're expecting that the additional fund request will be processed through the ministry, and we expect its approval. So that takes care of a significant item when it comes to dealing with the balance of the year. And I know there were questions by the board about how the process is to work. This is that process in play. The July financial statement reflects an underage, a deficit. That deficit is largely a result of we don't have approved funding, although we've applied for it. So that's largely to do with revenue. We had a small, not quite inconsequential, but we did certainly an overage in our expenditures overall for the month of July. Not unexpected, given the heavy response at that point in time that we were running multiple hubs and also continuing on with our mobile vaccine clinics. So heavy call on many resources to achieve those. So in terms of the operating budget, I can move to the capital budget. And this is largely our seniors dental two projects that we have underway. These projects have well approved. The funding has not been received yet from them, so we're cash flowing that through our financial resources. However, the ministry has come back and said that we will receive this funding by September 29th. That's, I'll just say, process. Our ability to financially manage through all of this process as a health unit, after conversations with others, other health units are struggling with their financial position, where we do not have that same concern. Immediate. I mean, if the funding doesn't come through, then the concerns change. However, I think we hold ourselves in good stead.
Thank you, Matt. Any questions regarding the financial statements? All right, I don't see any. I need a mover and seconder to receive the July 2021 financials as presented. Selwyn and Brian Millen, all in favor? That is carried, thank you. So we're on to item 10, other. The first one, 10.1, provincial appointment update.
So I can speak to that item, Madam Chair. We received the good news of renewal of the provincial member, Ms. Helen Claire Tangling, and the renewal is effective by the end of the year when the first year ends, and it will go for 2 years. So that's an update on that item.
Thank you. Good news. Congratulations, Helen Claire.
Congratulations. Congratulations to all of us, I must say.
Helen Claire.
Thank you. Thank you for those kind comments. I'm really grateful to be able to continue to serve as we come out of the pandemic. And I'm just wondering the status of the other provincial appointee. We desperately need to keep stability on the board, and it takes so long. And we don't want to lose. We don't want to lose Al Barfoot. And particularly it will mess up things at the executive level since he is the vice chair. So I'm just wondering if, through you, Madam Chair, if we had any news on that. Thank you.
Dr. Era?
Through you, Madam Chair, yes, the application for Mr. Barfoot has been submitted, and it's just the processing time usually is based on 6 months before the term expires. So it is within its time to be processed, I believe.
Okay.
Everything's been submitted. I think, Helen Claire, the same as through your process. Mine was just obviously started after yours because your appointment was made prior to mine. So yeah, as the expression goes, it's in the hopper.
Very good. Thank you. Item 10.2 is update on annual board orientation. Dr. Era.
Madam Chair, the board directed me last time to connect with the Alpha recommended lawyer for orientation of the board, and the orientation could be done in 2 sessions. Discussion with yourself. We thought it would be appropriate to have 1 hour before or after the board meeting over 2 board meetings that will complete that orientation. So with your permission, we can send calendar invites or to see the preference of the board members, whether we need to meet before the board meeting or after, and we'll arrange for that session.
Okay, just a quick poll. How does everyone feel, before or after? I actually thought we might be fresher before the board meeting, but your thoughts? Brian Millen?
Yeah, I'd agree. Go ahead of the board meeting.
Ahead of it, yeah, because you never know how long the board meeting will last.
Yeah, that's a bit of a wild card, but I would say that if you start at 9 o'clock for the training, you have that hard stop at 10 for the board meeting to start. So
yes,
it kind of stops it there. Anyway, that's my opinion. Thank you.
Selwyn?
The point that I would make is that there's usually a Grey Bruce Healthy Communities partnership meeting just prior to the board meeting, as there was this morning. It starts at 8 o'clock, so that might create a conflict. But if it's a one-time thing, I suppose I could jump out of that an hour early and attend the training.
Yeah, it would take 2 meetings, two of our board meetings. So Brian O'Leary?
Just that I would agree to do it beforehand. I'm a little bit surprised that Brian Millen wants to do it beforehand. He usually wants to be later so he can get chores done or whatever, but that's fine.
He's eager. Helen Claire?
Yes, I'm an outlier here. I'm wondering if it can't be done on a separate day. And if I'm hearing 2 sessions, if we couldn't have the 2 sessions done on a separate day. I have some concerns that we're going to have a hard stop for something because the training, I believe, is very necessary and needs to take as long as is required with questions and so on. With regard to the freshness, yes, but we need to be fresh for the training, but we also need to be fresh for the board. But of course, I will surrender to whatever the group decides. Thank you.
Mitch?
I'm just wondering if we should wait till December because there could be some new board members coming on with the 2 counties. And that might be a good time to have the orientation for the possibility of new board members. So I'm just throwing that out there as well.
That's true too. I'm seeing a lot of nodding heads for that, Dr. Era. Appointments are made in December, right? I forget. So, Helen Claire?
Yes, I'm initially nodding my head about that too. But on the other hand, I think since placements are made from the municipalities and since this education is useful to municipal members as well, I don't see it as a big deal if we have it in advance of, and then if there needs to be something else after, I don't see that as a big deal, budget permitting. Thank you.
Okay. So we have, yes, Dr. Era.
Budget has no issue with the budget. We have the orientation of the board as an item, biannual item, so it will be there. And I will follow whatever the board decide.
Selwyn?
So given that discussion, I think I would prefer a special meeting to deal with the orientation, as it will likely interfere with 2 meetings of that Grey Bruce Healthy Communities Partnership. And there's a lot of important information that's shared at those meetings, and I would hate to miss 2 of them.
Okay, so we'll try for a separate day, more than likely a Friday, if that works with everyone. And maybe we could start at 10, Brian, rather than 9.
Well, that way I'll get my chores done.
There you go. Yeah, we need those chores done. We don't want
You
anybody.
betcha. Yeah, we don't want the cows to go hungry.
Right. Dr. Era, is that enough information for you to go ahead?
Yes, Madam Chair.
Okay, good. All right, good discussion. Let's move on. Item 10.3, board policy biannual review. Matt, are you leading this?
Okay. Yes, Madam Chair. So you have a memorandum in front of you that talks about a number of things. I just wanted to walk through just a few options. I really think of it as that way, as options. We don't have bylaws. I think at one point we did have some bylaws as an organization, but currently we have just policies. However, bylaws versus policies, we are making the recommendation, or management's making the recommendation, that you consider creating, once passed through the review stage, actually creating appropriate bylaws that encompass a series of policies. So that's the first for consideration. The second one is the actual schedule for review that was also presented to you, along with the first 11 policies. So I now open it up to questions, comments, direction.
Thank you, Matt. Any comments regarding that process? Must be a good process, Matt. Brian Millen?
Yeah, I thank you, Madam Chair. Yeah, I like Matt's suggestion there. Bylaws are always preferable to a simple policy for a lot of matters, at least. So I would agree with that, and yep, I'm good.
Okay. So Matt, are we going to review how many did you just send out? 10?
There were 11 policies sent out. It's my desire, or our desire, that you review the policies as policies so we meet the expectation. Then once we're through the policy review, I'll look for direction we'll look for direction to engage. Likely need to go through a lawyer to craft the proper bylaws. So did you have it? So because this was sent out about a week and a half ago, I'm hoping that you had the chance to review. And if you had questions on any of the policies or suggested edits, etc., those can be brought forward either directly at this point or through communication subsequent.
Okay. So has everyone had a chance to review the first 11? And if so, any changes or whatever, edits? Helen Claire?
Yes, I have a few comments, and I wasn't sure if we would be going through this today or how. Madam Chair, would you like me to proceed through them at this time?
Matt, is that what you're considering?
It's really up to the board as to how they would like to proceed on, because there may be many potential changes put forward. In this, you can either do it in the open session here, or you can actually send the information back to management. We'll collate them and then resend that back out to all board members so they can see the suggested changes or questions. Or a hybrid of. I'm open to what makes most sense to the board.
I'd like to see the second one where, because of time, and I know people are going to more meetings, other meetings this afternoon, if you would send those changes to Matt, is that correct? Directly to you or to Mary?
It'll be to Mary.
Okay.
That'll be the admin medical officer of health account.
And do you prefer tracking on the document or just like an email
Yes.
in the body of the email? I guess whatever works, right?
But honestly, I prefer the document have track changes and whatever. So you put comments in that Word document. You can also put your suggested edits if that's also you deem appropriate. And those can be collated so that all received can be put into one document for that particular policy, and that can be reissued back out for everyone's view.
Okay, and if you're like me and you're not comfortable or know how to use tracking, just put it in the message in the body of the email message.
Absolutely.
Madam Chair, yes, I was going to say that if it's easier for the board member, they can just send their comments in any format and we can incorporate it in a Word document.
Okay. Helen Claire?
Yes, again, I'm an outlier. I gotta say, I'm not a fan of this. I'm not a fan of one-sided communication. I think discussion is very good. I also think it takes a lot more time if individuals are sending stuff that might be repeated. That would be avoided if we had a meeting and discussed as a group. You may recall also that when we raised this last time, there was some discussion whether this should be done in a group or whether there should be a subcommittee. And I did raise the point that it would take a lot more time to try to do it this way. So I'm just reiterating that point today and reiterating my offer certainly to sit on a subcommittee to take a bash at this and present it back to the whole. And that's what I've got. Thank you.
Thank you. Selwyn?
So whether it be a subcommittee or this group, I think we should spend the appropriate time to have some discussion. I would just say, if I can squeeze this in, I don't know whether it would come under mission, vision, and values or under, what's the other one here? Operational philosophy. But I don't see any mention, and I wonder if we would not want to have some sort of specific mention of our relationship with our Indigenous communities, because they are somewhat autonomous. I mean, if I look at COVID, for example, we are certainly playing a role, but we are very much playing a role where they are in control and in charge, and we are being called in to assist. So I just wonder, what is the appropriate place to have that in? Is it in the mission, vision, and values, or is it in the operational, the operational philosophy? Just wondering what others thought about that.
Well, okay, let's revisit. Do you want to have a meeting of the whole board to review these, or do you want a subcommittee? I'm hearing a subcommittee from Helen Claire.
No, I'm also totally open to a meeting of the whole. I just think we need to have a discussion. Thank you.
Okay, Brian Millen.
I was going to say, if there are so inclined individuals like Helen Claire that want to delve into this as a committee, then I'm fully supportive of doing that. I'll be the first to admit this is not my thing, but it is important. I'll agree. And if there's individuals that are very much interested in this, then have at her. I'm fully supportive of that.
Okay.
But having said that, I'm not going to volunteer for the committee either. So I'm just saying.
I got that. Alan?
I was just going to say, we do have the executive committee. If this was something that the board wanted the executive committee to take on, I'm sure that could be accomplished that way as well.
Could, and anyone can join for this specific job. Brian Millen?
I was just going to say, Madam Chair, if you want a motion to delegate this to the executive committee? Would something like that be acceptable or appropriate? To bring the recommendation back to the board as a whole, of course, but to actually go through the policies and so on, or maybe we just give direction to the executive committee to take that on. I don't know.
I think direction is just fine. I don't think we need a motion.
Perfect.
If that's agreeable to the executive. I'm seeing nodding heads, not from the executive, but Selwyn, did you have a comment or?
Sure, it can be the executive, Madam Chair. I also don't mind. I guess when I saw it come the way that it did, I thought if you had, there were 11 that were presented to us, we would have read them in advance of the meeting. If we have comments, we could make them. I don't feel a need to make a comment on every policy that I see, but there might be some and some issues that I want to raise. And we could do that without, I think, occupying a lot of time of the group. But it is kind of nice to be able to have a reflection from other members of the board. So I don't know if I'm leaning anyway. I don't have a preference, to be honest, but if I'm leaning anyway, I would say I prefer that it come to the full board, but being conscious of time and making sure that we read in advance and we speak on only the things that you have concerns about. I don't think we need to address every single policy that comes before us unless there's something in there that needs to be addressed.
Okay. Mitch, can I get your opinion on it?
Well, my opinion is I think we have the executive committee, and to have them go over it, vet it through, then comes back to the board, and we all have our comments as a whole, like Helen Claire has mentioned, then we all can have a fulsome discussion.
Okay, so you're giving us direction to review it the first time and then come back. Brian O'Leary.
Just that I would agree, the executive is fine.
Okay, I think we have consensus there. So we'll leave it, Dr. Era, we'll leave it up to you and staff to arrange a time for the executive somehow that we'll go through these first 11 and keep working on them. Hopefully we'll have this done before the next board meeting. Dr. Era?
Yes, Madam Chair, clear direction. I just want to add one thought there, one piece of information. Being Northern Ontario School of Medicine teaching site, in the future, we will definitely have the option to have residents, physicians who are specializing in public health to be an MOH or a specialist in public health, doing rotations in health policy. Such individual or such rotation can be a tool for the board to utilize to review the board policies. I looked into the list of residents and their interest for the coming 4 months. I didn't find anybody with that specific lens, but in 2022, I suspect there will be a couple.
Well, that'd be good. Yes. Okay, so that we've got direction on that. The executive is going to review the policies first, make our changes, suggestions, recommendations, and then bring it back to the board for a further discussion and then go from there. So we'll get working on that. That is it for other. And I'll just ask, does anyone else have anything they would like to comment or discuss? And if not, we need a motion to adjourn at 12:20. I need a mover, Helen Claire and Brian O'Leary. All in favor? That is carried. Thank you. Have a good day.
Bye, everybody. Thank you.
Good day, all.
And okay, Dr. Era, Nick has put a question on there.
Which ones? I don't know it
Right.
off the cuff. I can circulate it to the board members by email as well. And
good idea. Okay, so thanks everyone. Have a good day. Enjoy your weekend.
Thank you.